WHO estimates that one woman dies of cervical cancer every 2 minutes. It says that each one is a tragedy and we can definitely prevent it. India accounts for almost 20% of all cervical cancer cases happening worldwide, and yearly India contributes to 1,23,000 cases and 75,000 deaths from cervical cancer annually. India contributes to almost 25% of all cervical cancer deaths happening worldwide due to cervical cancer. Cervical cancer is definitely a major public health problem in India, and this problem is only going to increase further in the coming years if we do not take preventive actions right from now. Cervical cancer is majorly caused due to a virus which is called human papillomavirus. Human papillomavirus, or HPV virus as it is commonly called, is the most common sexually transmitted infection happening in men and women. So whenever a couple starts their sexual life, almost 90% of them will develop HPV virus infection in the genitalia in the next 6 months. But at the same time, majority of these women will also be able to clear this infection from their genitalia in the next 6 months with the help of body's own immunity. Those women in whom this HPV virus infection remains persistent in their genitalia, or who are not able to clear the virus with the help of their own immunity, these are the women who are at the highest risk of developing cervical cancer subsequently. So now that we know that cervical cancer is caused by a virus, we also have a vaccine against it. We say that cervical cancer is the most preventable cancer of all. And we say this because we have two very strong tools to fight against cervical cancer. The most important one is the HPV vaccine. HPV vaccines, they prevent HPV infection and hence prevent cervical precancer and cancer. It is recommended that all girls between the age 9 to 14 years of age should be vaccinated with HPV vaccines, and this would definitely be the most important reason why we should be able to decrease the incidence of cervical cancer in India. If a girl has missed this opportunity of taking the vaccine between 9 to 14 years of age, she can still take the vaccine whenever she can, but most ideally this vaccine should be taken before she becomes sexually active. The other strong tool that we have to prevent and fight cervical cancer is pap smear screening. Pap smear is a simple gynecological test. It's a non-invasive test, does not require any admission in the hospital. Any gynecologist near you will be able to do it. So pap smear basically is collection of cervical smear, which is then studied under the microscope to see if there are any abnormal cells developing. So pap smear can diagnose a cervical abnormality or cervical precancer much before the cancer actually develops. And when we treat the cervical precancer, we actually prevent this woman from developing cervical cancer. So this is how we say that cervical cancer is absolutely preventable. Other major step is early detection of cervical cancer. Early detection of cervical cancer is possible only when majority of us are aware of the most common symptoms and signs of cervical cancer, which are any abnormal vaginal discharge, especially if it is foul smelling, any abnormal menstrual pattern of bleeding, like bleeding in between periods, post-coital or post-sexual contact bleeding, any bleeding in post-menopausal woman who has achieved her menopause. If there is any episode of spotting or bleeding, definitely that should not be ignored and she should consult a gynecologist. Sometimes there can be burning in urine, there can be lower abdominal pain, but vaginal discharge or abnormal patterns of vaginal bleeding, these are the two most important symptoms one should watch out for and should never ignore. So early detection of cancer, it is the key towards cure of cancer. Whenever cancer, and especially cervical cancer, is diagnosed in early stage, the cancer will be curable with the most simple treatment methods. Whereas if cervical cancer is diagnosed in more advanced stages, treatment protocols become more complicated, the treatment may be more expensive, and also sometimes we may not be able to guarantee cure. And hence we advocate that all women should make themselves aware of the preventive strategies against cervical cancer, of the most common symptoms and signs of cervical cancer, so that they can prevent, or at least detect early if there are any abnormal symptoms and signs.